Yeah, we would like you to introduce yourself to the audience, and then audience have a couple of questions for you already. Around 94 people have reached out to you, so
Yes.
we can go into their questions actually.
Yeah. Hello everyone. Good afternoon. I am Dr. Lakshmi Kona, bariatric surgeon at Yashoda Hospitals, Hyderabad. Welcome to our Facebook Live, where we'll be talking on this management of obesity. All modalities of management we'll discuss, and also if you have any questions, please use this time to ask us, and definitely I'll be very happy to give an idea about what are the ways of handling obesity, because obesity is one of the major problems of this era, and it'll increase because of our adapting the bad eating habits, which has become ingrained into all of us, and also not having adequate time or not having the inclination to exercise. So we are seeing more and more people putting on weight, and also the diseases linked to this weight related disease, that is obesity. Obesity itself is a disease. We are seeing a significant increase in the number of diseases which are directly linked to obesity. We are seeing more and more people becoming diabetic. We are again seeing an increase in cardiac events. Cardiac events means we are seeing young people developing cardiac diseases and sometimes succumbing to the cardiac diseases. And then we are seeing a lot of increase in the cancers linked to obesity. We are seeing a lot of increase in breast cancers. We are seeing an increase in the ovarian endometrial cancers, pancreatic cancers. So these are all increasing. We are seeing more people now coming for liver transplant, not because of viral infection, not because of hepatitis B and hepatitis C, but because of fatty liver. Fatty liver causing liver cirrhosis, and the person is needing a liver transplant. Also, we have, and if an obese person requires a liver, then there is no way they can get a liver. There is no, an obese person cannot donate his organs to anyone because they're already damaged. A normal body weight person's organ will not be sufficient for them. So it is a double disaster. If you're obese and you end up with any organ damage, heart, lung, kidney, liver, then there's no way, in spite of the good advances in the management of end organ disease, no one can save you. So that is why we should, as doctors and physicians who have been treating obesity for so many years, it is our, what we can say, responsibility to keep on educating the general public regarding this obesity, because till a person collapses, no one takes their good healthy life seriously. So we see people obese, not bothering, going around till they come to the hospital almost dying. So we don't want that to happen. If you are looking for treatment for so many diseases and willing to get treated, even think of getting your obesity treated. If there are any questions, we can.
Yeah, so thanks for that. There are a lot of questions from people. So there's one question from Swagata. How to manage menopausal obesity?
Yeah. Swagata's question was how to manage menopausal obesity. Yes, there are different phases in a female's life when there are chances that they can become obese. Just because you have attained menopause, you will become obese. There is no need for that. But during your menarche, teens, and pregnancy and menopausal time, that is when there is a lot of change in the metabolism and the female hormonal system. So that causes a tendency to gain weight. Not mandatory that you need to gain weight during those periods. So that is why right from the time a child is born, it's duty of the parents to train them to eat healthy and adapt an active lifestyle. If the child or the young adult is allowed to eat whatever they want to eat, they don't want to eat healthy food, pamper them with all high calorie foods, and then they start gaining weight, and then you start blaming your age or time or pregnancy or wedding for cause of obesity is not correct. So during menopause, lot of ladies take a back seat, and they don't as such only till now they have not maintained their diet and active lifestyle properly. So with menopause and hormonal changes, they become more laid back, and that's how when the weight gain happens. And when weight starts increasing in your middle age, then it's very difficult to get rid of it. So even before you touch menopause, make sure you're changing to a healthy eating and adapt active lifestyle, including exercise, in your day-to-day life. That is the best way you can prevent menopausal obesity.
Thanks, ma'am. So we have another question from Jay Krishna. I would like to know about the relationship between obesity causing diabetes.
Yes, type 2 diabetes, type 1 diabetes is a different disease. Type 2 diabetes is basically because of insulin resistance. So when you're obese, your fat is a big positive factor for insulin resistance. That is how obese people become diabetic. And as if you are not getting rid of your weight, then your obesity will progress, and slowly you will go into becoming an insulin dependent diabetic. So if you reduce your weight, keep your weight under check, then type 2 diabetes will not happen in the younger age group. But if you neglect yourself, then become obese, then your insulin resistance will cause type 2 diabetes.
Thanks, ma'am. So there is another question from Bandi Tinar Kumar. My weight is 130 kgs, having gout and pre-diabetic and pre-HTN. What do you suggest, ma'am? Height is 179 and weight is 130 kgs.
First, let us say your ideal body weight should be somewhere around 80-85 kgs. You're 179 centimeters. So minus 100 from that, you get 79. So round about 80-85 kg. So you have 50 kgs excess body weight, and already you're having hypertension, and most of your sugars will be borderline, and you're having gout. So hyperuricemia. Gout is hyperuricemia. So all these are a part of the bad metabolic syndrome. So to get rid of all these problems, you need to lose weight. But with your gout and high blood pressure and so much obesity, almost 40-45 BMI you will be, roughly I'm telling you, definitely you will not be able to lose weight on your own, because your system will not tolerate intensive exercise, which is also necessary to lose weight. So when you are not able to exercise and your body weight is such, my sincere advice is think of bariatric surgery as the best option to give you weight loss. Not only it will give you weight loss, but it will reset your bad metabolic syndrome and reverse your hyperuricemia, your hypertension, and your pre-diabetic or diabetic status. That is my best advice to you.
So now there's another question from Anshu Singh.
Yes.
Ma'am, can I go back to normal lifestyle after weight loss?
Yes, you should be back as quickly go back to your normal lifestyle after your weight loss surgery. That is the best thing. Active lifestyle, including eating healthy, which the training will be given by the dietitian team to all those who are coming for weight loss. The dietitian team will train them to eat healthy over some time, and also you should adapt doing regular exercise, and definitely both diet and exercise along with surgery will definitely give you a good weight loss and maintain your weight loss for long many years.
Okay. So there's another question from Monica. After pregnancy, my weight is increasing. Any suggestions?
Yes, after pregnancy, normally with pregnancy there is a 12 to 14 kgs weight gain. That is part of the natural pregnancy, because that the nature is creating some amount of fat to take care of the baby's nutrition. But once you are finished with your baby delivery and your lactation, you should get back to a very active lifestyle, exercise daily, make sure you get rid of that 10 to 12 kgs what you have gained during pregnancy, so that before you have your next pregnancy, you lose this 10 12 kgs. Otherwise, with every pregnancy, if you keep gaining this 10 or 12 kgs, 2 or 3 pregnancies later, you're 30 40 kgs above your normal body weight. So get back to exercising once you're finished your baby's lactation. Till if you're lactating your baby, then I would suggest at least go for a walk daily. That will not only keep your weight in check, but also get your tummy muscles, which have already sagged because of the pregnancy, to come back into normal shape.
Thanks, ma'am. So there's another question from Priyadarshini. Ma'am, what is the process of the surgery and how many days to recover?
Yeah, the surgery works on the stomach and small intestines, and there are varieties of techniques depending upon the person's BMI, age, eating habits, medical problems. We decide which type of surgery to be done. So once the surgery is done, then the metabolic error, what has caused this obesity, changes, and the person starts losing weight. So average of 3 to 4 kgs a month to a period of 12 to 18 months, your weight loss will happen and then stop. Thereafter, you keep maintaining it with your healthy diet and the regular exercise.
Thanks, ma'am. There's another question. डॉक्टर साहब मेरा वेट 100 से ज्यादा है, बट डायबिटीज का चेकअप करवाना जरूरी है.
यस, 100 से ज्यादा है, यू शुड गेट डायबिटीज चेक कर लीजिए, क्योंकि कभी ना कभी तो वो हो जाएगा. बट ये चेकिंग करने से पहले वो 100 केजीज को कम करने का भी एक सोच आना चाहिए. सिर्फ टेस्ट करने से बीमारी भाग नहीं जाता, या आए हुआ बीमारी वो टेस्ट से डर नहीं जाता है. पहले बीमारी नहीं आने का सोच अपने दिमाग में आना चाहिए, और उसके लिए जो भी कदम उठाना जरूरी है वो करिए.
There's a question from Salva Sahib. How does an obese mother affect her infant's weight and health after birth?
Yes, a obese mother will cause the obesity to start in the unborn child. So that is why it is mandatory that if a lady is planning to conceive, first get your weight under control. Otherwise, definitely you will give birth to children who may be normal weight at birth, but definitely they will quickly become obese in the short run. So obese mother will give to obese offspring, or children with the tendency to quickly gain weight. So that's why it is important for all the ladies in the childbearing age or for any age to keep their weight under control.
Okay. So there's another question from Kartika. Ma'am, what is the difference between liposuction and surgery? Is liposuction effective?
No, liposuction is a totally different thing. It is not meant for weight loss, and no one gives you for weight loss also. It is meant for body contouring. It is to give shape to your body. But when you have kgs and kgs of weight to lose, nothing can give you shape except a big weight loss. And that is where bariatric surgery comes in. So bariatric surgery is to give you massive weight loss, and liposuction is to give a shape to your body. That is, if you're thin, normal weight and have a little extra fat on your arms or tummy or thighs, which you want to get rid of, and that too, it lasts for a short time. It is not a permanent body shaping thing. It lasts for a short time, and you need to maintain that little, whatever fat is removed, that also again you have to maintain it with again proper exercise and diet control.
Okay. And there's a follow-up question with the person who asked before. So इसका process है क्या? करना होता है because मेरा weight मान कम नहीं होता.
जिम में नहीं कर पाता. Definitely with 100 kgs weight, even if I am 100 kgs, I will not be able to exercise. See, your heart and lungs have to tolerate your, आपका weight संभालना चाहिए ना. आपका हार्ट और लंग्स के ऊपर उतना वेट डाल के आप सोचोगे एक्सरसाइज कर लोगे, उतना आसान नहीं. आप जिन को जिम या मॉडल्स देखते हो एक्सरसाइज करते वक्त, वो उतना पतला बॉडी के साथ कर रहे हैं. अगर वो 200 kg होता तो हमारा तरह वो भी एक्सरसाइज नहीं कर पाते. इसीलिए अगर आपको सचमुच आपका वेट का फिकर है तो हॉस्पिटल आके डॉक्टर से कंसल्ट करो, ठीक है। ये ऐसा ओपन पब्लिक फोरम में तो हम लोग पेशेंट को एडवाइस, जनरल एडवाइस दे सकते, बट बीमारी के हिसाब से बात करना है तो वो इंडिविजुअलाइज्ड होता है, आपके जरूरत के हिसाब से होता है। बहुत सारा प्राइवेट मतलब आपका बॉडी के बारे में सब डिस्कशंस में ओपनली ये फेसबुक लाइव पे करना नहीं चाहती हूँ। आपको सचमुच इंटरेस्टेड है, आर यू रियली इंटरेस्टेड टू लूज योर वेट, come and consult us, definitely will help you.
There's another question from Shreya. Can the infertility be due to diabetes? Is it curable?
Infertility could be because of lot of things. Infertility could be because of diabetes, because of hypothyroid status, because of obesity. Obesity is one of the major cause of infertility in the present era. You see lot of ladies are obese and still fighting and trying to conceive. Any IVF treatment will not work beyond 30 BMI. So if you're obese and planning to have IVF treatment and have your baby, first lose weight. Definitely any metabolic problem comes in the way of fertility, because nature doesn't want a sick mother to have a baby, you understand? It is Mother Nature who is preventing. Diabetic mother will have a child, the child will be born with again some genetic problem, or some again, or born with diabetes. So that is why nature is preventing you to have the baby. Nature wants a healthy mother and a healthy child. So think of controlling your diabetes. Then if you have obesity as a problem, think of weight loss. If you have thyroid as a problem, correct that. Then only plan your pregnancy. Then your pregnancy will go smooth and safe.
Ma'am, there's a follow-up question which is similar to the same topic on hormonal changes due to obesity, and what can be addressed?
Yeah, obesity causes lot of bad hormonal changes. It causes, what is visible is your type 2 diabetes, hypertension, high cholesterol, someone said gout, fatty liver. These are all visible. PCOS, these are all visible hormonal problems of obesity, because obese fat, which causes the big weight gain, produces lot of bad hormones which go and damage each and every system. So that is why obese people tend to end up with lot of medical issues. So you should lose weight.
And there's a question from Priya Kundu. Ma'am, I'm Priya, 22 years of age. I'm doing night shifts in hospital as a duty doctor. I have PCOS and obesity. How do I manage?
See, being a doctor, first you should know that okay, now you have night shifts, no, but you will not have continuous night shifts. No medical college, no hospital will ever put continuous night shifts. You do 1 day or 2 days night shift, third day you have off. Okay. If you're doing night shift, you're reporting to the hospital in the evening. You have the whole day to yourself. So within that daytime, you should pick up 1 hour. You sleep, you go home, you sleep for 7-8 hours, get up, do exercise, control your eating. Don't get tempted to eating all the fatty food which is available in the hospital cafeteria. Try to eat healthy, okay? And when you are in the hospital, if there is no work, I would suggest use the hospital corridors as your exercise floor. Keep walking. I think hospital is the best place to lose weight. Keep walking all the corridors, okay? Don't sit and do. If you have no work, you keep walking in the corridors. Anyway, if your patient demands work, then definitely you are up and about. So use the hospital evening time at least for 1 hour. Keep walking in the corridors. I once had an anesthesia friend who lost 20 kgs just walking in the OT corridor. Whenever he has time, he would just walk this end of the corridor to that thing. So it is the intent that if I want to lose weight, I will definitely follow. When we suggest weight loss to people, then they will start telling all reasons. Oh, people told me this will happen with weight loss, that will happen with weight loss, but they don't know. When obesity will strike, it will not even give you a chance to live. So don't listen to people who say that if you undergo weight loss surgery, something will happen. Oh, I can't exercise. I have baby. I have work. That is all your ways of avoiding active lifestyle. So always think different ways to keep yourself fit in whatever working schedule you have.
Thanks, ma'am. So there's a question from Sarah. What supplements are essential in weight loss to ensure prevention of hair loss and other minerals and vitamin deficiencies?
To prevent hair loss when you're losing weight by any means, by diet and exercise, medication or surgery, you should eat good quality protein. Lot of people don't eat protein. They are only craving for carbohydrates. So that is one of the major reasons for hair fall following weight loss. So if you eat your protein food well, and you just need to take your iron, calcium and multivitamin supplement. Only vitamin supplements will not prevent hair fall for anyone, because hair, skin, everything depends upon your protein intake. So if you're not taking good quality protein, your hair will go.
And there's another question. मेरा medical insurance cover करेगा surgery?
Yes, IRDA has issued guidelines from January of 2021 that insurance covers bariatric surgery, but आपका insurance cover, how much is your insurance coverage? If you have the small insurances which are good for nothing, 2 lakh, 3 lakh, 5 lakh, it is not enough for any sort of treatment. You better change your insurances to high coverage insurances, at least above 15 to 25 lakhs for young people. If you are middle-aged and above, have a 1 crore health insurance, because with the 3 lakh, 5 lakh insurance, you cannot afford any of the medical treatment in good institutes or good medical, good hospitals. Ultimately, when the right time comes and you need treatment, those insurance will never cover your any treatment. So improve your insurance plans, and bariatric surgery is covered by insurance.
Well, there's a question from Dr. Asra. Ma'am, your opinion on latest drugs and treatments for obesity?
Yeah, now there are a lot of drugs available for weight loss, but understand they all have their limitations. They will not give you a big weight loss. They will give you maybe 10 to 15% of your excess body weight, and the drugs have to be taken for lifetime. And whenever you stop the medication, the drugs, the weight, whatever you lost will come back immediately. And you have to also tolerate the big dosage of the drugs. They are synthetic chemicals, so sometimes some people will not tolerate them because of the nausea or diarrhea or vomitings the drugs can cause. And also the drugs come with a monthly cost, that every month you are paying, spending some 25,000-30,000 every month for your lifetime to achieve and maintain the weight loss. So you have to be judicious in using, and if it is a big weight to be lost, drugs will not help you. Small weight to be lost, or if you're a diabetic and you need to lose 5-10 kgs, you can use the drugs, lose weight and maintain the weight loss with the drugs for lifetime.
Thank you, ma'am. There's another question, ma'am. मेरी pregnancy के बाद से stomach की skin loose हो गई.
Skin loose हो गया, आप exercise करो. Simple. See, for anyone, I am telling straight. If you want everything healthy, everything looking fit and fine, you have to put effort. Nothing comes easy. No one can give you easy. Okay? So if you are not doing exercise, your stomach skin will sag and it will look ugly.
Which type of supplement should I take for skin and hair, as you already addressed?
Healthy fruits and vegetables and good protein in your diet. That is the best natural supplements you should take for a healthy skin and hair.
There's another question from Vinsha Sultan. Prevalence of diabetes and obesity.
Okay. Type 2 diabetes is 80% of the obese will get type 2 diabetes. 80% of the obese will get type 2 diabetes. So obesity and diabetes go hand in hand. If you're obese, you'll become diabetic. No one can prevent. So don't become obese, or at least try to lose weight to prevent diabetes from coming.
And there's a question from Khalid. He's 100 kgs and 164 centimeters. He's asking what is the root cause of alignments?
Root cause of
Alignments, if I'm not wrong. Ailments.
ailments. Root cause, if you are obese, your obesity is the root cause of all the diseases, ailments or diseases, if he means that.
There's another question from Aisha. How to identify signs of diabetes in early 30s?
See, if you're at the early 30s, if you're feeling fatigued at work, or you're feeling excessively hungry, or you're feeling excessively thirsty, or you're having excessive urination, or you're developing something like a UTI, or you're developing small skin infections, then you need to get your sugars checked.
We have last two questions now. If someone is having thyroid, and how does it affect diabetes? Is it curable?
No, thyroid is thyroid, diabetes is diabetes, but definitely hypothyroid people have more chances of developing diabetes because thyroid hormone is a very important hormone for all the metabolic cycles which happen in the system. So if you're hypothyroid and you keep on going like that, your glucose metabolism will get affected and you will become diabetic. So you can't cure thyroid, means you can't, if you're hypothyroid, you need to take thyroxine supplement for lifetime. But if you are hypothyroid and not taking your medicines, you will develop diabetes. So to prevent diabetes from setting in, keep your thyroid levels under control, keep your weight under control, and even thin people also should adapt exercise daily, because even thin people can become diabetic if they're not careful with their diet and exercise.
Two more questions. So someone is asking, due to overweight, can they having leg pains?
Yes.
And joint pains?
Yes.
So
They will have.
Good reasons, if you could explain them.
Reasons are that your body, whatever your body per kg meter square we measure. So if your height is 150 centimeters, means your body can tolerate a weight of 50 kgs. And if your height is 153 centimeters and you're 100 kgs, means you're putting another 50 kgs weight on your joints. It is like I always tell whoever comes to me, if you have a cycle which can carry 50 kgs and you want to put a 100 kg bag on it, what will happen to the cycle? It will break. Same thing, your joints, your spine are all very delicate parts. You just can't expect that they will carry that excess weight daily, day in, day out, and won't complain. So depending on your body structure, your weight has to be limited to the reasonable amount depending on your height.
Thanks, sir. So I have kept this question last to close up. Diet tips for losing weight in a healthy way, if you can suggest to the audience.
Yes. Eat less. Always lot of people ask what to eat to lose weight. I said learn to eat less. Eat more protein, more fiber, less carbohydrate, and avoid very high calorie foodstuffs in form of fruit juices. Fruit juices are not at all healthy. They are very unhealthy. Okay, your Pepsi, Cokes, all your Cadbury's, all your chocolate bars, your weekend binging, okay, ordering so much food and eating, going to a movie, people will eat big buckets of popcorn. That's all calories. Understand? If you're not exercising, your body is not able to remove the calories what you're eating with your regular diet, and then you start pouring so many calories into that. Children are all pampered to birthdays and all with only high calorie food. So you are actually damaging your child's future by making them used to eating high calorie food. Don't treat your child with food. Give them anything else. You can give them clothes, you can give them books, you can give them anything else, but don't come, oh, you did good in this subject, come, we'll go out and eat this, come, we'll eat ice cream. Don't train your children like that. And for all the young adults, any little thing, party, and then they go and eat in those buffets, unlimited food, and then they don't want weight gain, it will not happen like that. So learn to eat less and eat more fiber, eat more fruits and vegetables, learn to eat good quality protein, and exercise daily. That is more important. And parents of young children, make your children go to the park and play instead of making them sit the whole day and study. Their studying from now is not going to help them achieve everything in future. They should study as per the needs of that section, not some future thing. I want to reach the moon, so from class 1 I'm learning to reach the moon. It doesn't work like that. So let them go out and play, let them be active, and make them learn to eat the traditional Indian diet, which is the healthiest, not this fat diets where it's only fat and sugar and salt.
Thank you so much, ma'am. Just the last question from Aisha Nisha. Ma'am, any side effects of the surgery in the long run?
That's what. When we tell treatment, everyone asks of side effects. Do you know if you remain obese, what is the biggest thing that can happen? One day you can just die flat. Okay? Then after that, no one bothers whether you're there or not. So surgery is a treatment to give you rid of that weight and prevent all these major mishaps from happening. So I will always say that, like, you take 10 medicines for your diabetes and hypertension, think surgery as one more medicine for your weight loss, and get the surgery done. Surgery is very safe, and definitely we ourselves are doing almost for past 2 decades this surgery, and we have not seen anything major dangerous happening to any of our patients who are happening. Have faith in science and medical treatment and get the proper treatment done.
That's it, ma'am. Thank you so much.
Thank you all. Hope whatever I have said is taken in the right way, and you use this to improve your quality of life and your health. Thank you.